NIH and Wuhan Institute of Virology were working on monkeypox drugs and tests back in 2020. Monkeypox is probably the most widely publicized disease that's had fewer than 2,000 cases reported worldwide, that is, and without a significant number of deaths or even serious symptoms. So one has to ask, why is the news media even reporting on this disease as if it's going to be the next pandemic? Well, if that's strange, you're going to find the very next piece of the puzzle even more bizarre. Both the NIH and the Wuhan Institute of Virology were both working on various monkeypox projects prior to any news media coverage. Now, you are already aware that the NIH and the Wuhan lab were both accused of being involved in the development of another infamous virus. So when one hears these two organizations named again as working on another virus prior to it being internationally well known, or frankly before there's even an outbreak of cases, well, that certainly perks up our ears. But before we give you the facts, subscribe to this Rumble channel. You probably know us from our YouTube channel, but we want to release more edgy material, so this is where we plan to do it. Now, back to the monkeypox NIH Wuhan saga. The National Institutes of Health did a trial on the safety and efficacy of an antiviral treatment for patients with monkeypox. The NIH funded this trial to the tune of $10 million. $10 million to develop a treatment for monkeypox. Did I get that right? A disease that in 2020, when all this started, had no publicity and almost no cases outside of Africa. Does this make sense? Out of the thousands of viruses out there, they pick one with almost no cases and low death rates, and they spend $10 million on it. Okay, so good that the National Institutes of Health anticipated that this virus would spread. That's very interesting, of course. It isn't the virus I would pick at random. Then there's the Wuhan Institute of Virology. You know, the one less than a mile from the wet market where they claim that COVID-19 started. The same lab funded by the NIH and Anthony Fauci to study coronaviruses. Did they anticipate this monkeypox outbreak also? Amazingly, it seems they did. In a paper published in February 2020, the Wuhan lab revealed they had developed a PCR test for monkeypox. Same kind of PCR that we have become familiar with that other well-known virus, COVID-19. Now, let me get this straight. The two most infamous organizations in the COVID pandemic, the NIH and the Wuhan lab, were working on monkeypox prior to a single media report or any cases outside of equatorial Africa. One developed the test for monkeypox, the other developed the treatment, and they spent millions of dollars on this. And now, monkeypox is all over the news. How convenient is that? I mean, imagine the odds. These guys really need to play the lottery because they are the luckiest scientists on the planet. Or maybe, of course, it wasn't luck. Maybe it was something more than luck. What do you think? Of course, it gets even deeper than that. And this is what you really need to hear. China said that since they didn't have a supply of monkeypox viruses, because there were so few cases, they had to make their own copy of the monkeypox genetic material. Stop the presses. Stop right there. China admitted they made a copy of the monkeypox viral material? Yes. They admit saying they couldn't buy any. There are a couple hundred cases a year in Africa. Wuhan, you can buy it, dudes. This all sounds so familiar to me, doesn't it to you? I mean, it's almost like COVID deja vu. Now, the name monkeypox should also sound familiar to another very famous virus, smallpox. They're closely related viruses. That's why their names are so similar. But smallpox is a very deadly virus that had been eliminated from the world stage back in the 1940s. But you know, if you can make monkeypox, you can make smallpox too. Just saying. By the way, If you have taken the smallpox vaccine, you are immune to monkeypox as well. However, by 1972, the smallpox vaccine was no longer given routinely in the United States. As a result, most people born in the United States after 1972, except for some military folks, have not been vaccinated against the disease. They also think the vaccine doesn't really give lifelong immunity, and even the people who have been vaccinated against smallpox probably would need to be re-vaccinated if a smallpox emergency developed. And smallpox has like a 30% mortality rate. 30% of the people who get it die. So it's a pretty big deal. You know, COVID had like less than a 1% mortality rate. So this is the one virus that bioterrorism experts are really worried about. It is the most feared virus in the world. So let's speculate a bit. How do all these odd coincidences, monkeypox being similar to smallpox, NIH is involved, Wuhan is involved, they made a copy of the monkeypox virus, how do all these facts possibly fit together? And remember, this is only guesswork on our part. Let's say some world-class, elite world bioterrorists want to release smallpox again, but they want maximum impact. You know, if they just release smallpox by itself, the world could pretty much react to it pretty quick and quarantine the area, roll out vaccines in that area, and eradicate it again. So instead, is there a way that they could release it stealthily? Might they release something like monkeypox first? Then might they release the smallpox? At first, because some of the symptoms are the same, the smallpox would spread quietly, undetected, with people thinking it was only the less dangerous monkeypox that was released first. But smallpox, which has a 30% mortality rate, will eventually be discovered because there are just too many people dying. So, if this suggested theory is correct, it would be a pandemic of smallpox in and among the monkeypox cases, both spreading worldwide. And if this happened, you know, the world would go crazy. The CDC only has 225,000 smallpox vaccines available, so it would lock the world down yet again. And it would be time for more jabs once they make more vaccine. Now, this is just a theory of why bad actors would want a monkeypox outbreak. But, you know, it's something to remember. It would certainly answer a lot of questions about why monkeypox is being made into such a big deal in the news media. We can continue to watch, and we'll see if we're right. Hopefully, we're not. Now, if you don't know about our YouTube channel, there is a link down in the description that will take you right there, and you can subscribe. We put about 4 videos a week out. We put out 4 videos about the last days every week. Till then, this is Nelson, and I'll see you there.